Mauritius is a small island nation built by resilient people. It has one of the most generous public healthcare systems in Africa, offering universal healthcare that is free at the point of use. Every single day, around 14,000 people walk into public hospitals, accident and emergency departments and health centres without paying a single rupee. General practitioners, specialists and emergency services are available regardless of income. In Mauritius, healthcare isn't supposed to depend on the size of your bank account. It is considered a fundamental right. According to a 2026 paper published in Frontiers in Public Health, Mauritius ranks second in Africa for universal health coverage, only 13 index points behind some of the world's highest performing healthcare systems. On paper, it's a success story, one that many countries would envy. But statistics only tell part of the story. A 2021 study found that the poorest 20% of Mauritians receive around 19.25% of all public healthcare benefits. In other words, the system is reaching the people it was designed to protect. The numbers are impressive. The experience, however, can be very different. Ask many Mauritians about their last visit to a public hospital, and the conversation often shifts away from statistics. It becomes personal. For many working-class patients, the first impression isn't compassion or reassurance. It's indifference. From the moment the health card is processed to the consultation itself, many people describe feeling like another number in a long queue, rather than a patient seeking help. Doctors often begin with a blunt "what happened?" without introducing themselves or explaining the consultation. Others describe appointments that feel rushed, dismissive, or unnecessarily cold. None of these experiences appear in official reports, but they appear repeatedly in conversations between families, on social media, and in everyday life. On their own, they may seem insignificant. Together, they shape how people view the public healthcare system. Officially, everyone is treated equally. In practice, many Mauritians believe it doesn't always feel that way. Some claim the way you're treated depends on who you know. Others believe appearance matters. Some say speaking fluent English or French earns more respect than speaking only Creole. Whether these perceptions reflect reality in every case is impossible to measure. But what is undeniable is how widespread those perceptions have become. And perception matters, because trust is one of the foundations of any healthcare system. If ordinary working-class citizens already feel ignored or judged, it also raises uncomfortable questions about the experiences of people who are even more vulnerable, including those living with HIV, people battling addiction, and sex workers. Public confidence has also been shaken by a series of highly publicised controversies over recent years. Between January 2020 and March 2025, the Medical Council received 155 allegations of medical negligence. Not every complaint resulted in wrongdoing, but every complaint represents a patient or a family who believed something had gone seriously wrong. In late 2023, G2 Hospital came under public criticism after allegations involving expired canned tomatoes and spoiled food served to patients. A few months earlier, in April 2023, an 89-year-old woman admitted to Victoria Hospital was reportedly bitten on the face by rats while in Ward 9, raising serious concerns about hygiene and hospital maintenance. Then there was one of the most heartbreaking cases in recent Mauritian history. In April 2021, baby Prishte Ram died during childbirth at SSR National Hospital in Pamplemousse. The tragedy became known across the country as the Bébé décapité case after widespread media reports described catastrophic complications during delivery. The story shocked Mauritius, not only because of the tragedy itself, but because it raised difficult questions about accountability inside the public healthcare system. More recently, in June 2026, another story spread rapidly across social media. A grieving sister explained that after being informed about the death of her brother, whom she was told died in October 2025, she went to get a death certificate. According to her account, the certificate stated that he had already been buried. She alleged that his body was still inside the mortuary at Dr. Bruno Cheong Hospital in Flack. She alleged that the body had been kept in an advanced state of decomposition, with fluids leaking from the body bag and severe deterioration visible. She said those images would stay with her for the rest of her life. Hospital authorities have not publicly confirmed those allegations. But the story reignited debate about standards inside public healthcare facilities. Each of these cases has its own circumstances, and allegations do not automatically prove negligence. But taken together, they have fueled a growing perception among many Mauritians that standards within parts of the public healthcare system are slipping. That perception has consequences, because once trust begins to disappear, people start looking elsewhere. Despite public healthcare remaining free, the latest WHO and World Bank estimates suggest that around 12% of Mauritian households now experience catastrophic healthcare expenditure, meaning healthcare costs consume more than 40% of their discretionary household budget. Researchers point to growing reliance on private healthcare and the high cost of medicines as major reasons behind this trend. For many Mauritians, the issue isn't simply money, it's confidence. Many are prepared to pay for private healthcare whenever they can afford it, not necessarily because private doctors are better, but because they believe they'll be treated with more respect, spend less time waiting, and receive a better overall experience. And that's perhaps the greatest irony. Mauritius has built one of Africa's strongest universal healthcare systems. It has expanded access. It has protected millions from the financial barriers that exist in many other countries. Yet for some people, free healthcare no longer feels like enough. Because healthcare isn't judged only by the treatments patients receive, it's judged by how they're treated while receiving them. Universal healthcare is about more than free consultations, more than hospital buildings, more than medical statistics. It's about competence, it's about accountability, it's about dignity.